counselling is. The everyday pressures of life are becoming even greater, meaning that many people are turning to counselling for support. The British Association for Counselling and Psychotherapy, BACP, define counselling as taking place when a counsellor sees a client in a private and confidential setting to explore a difficulty the client is having, distress they may be experiencing, or perhaps dissatisfaction with life or loss of a sense of direction and purpose. It is always at the request of the client, as no one can properly be sent for counselling. This is an important point to note, as clients who feel reluctant to attend counselling are unlikely to get the best out of their sessions. The process of counselling can be clearly defined as the means by which one person helps another to clarify his or her life situation and to decide further lines of action.
Can anyone be a counsellor?
Yes, counsellors come from all walks of life. You just need to have a genuine interest in helping others. There is currently no legal requirement in the UK to have any specific training or experience in order to practice as or call yourself a counsellor. But imagine if you were looking for a counsellor. You would want to know that the person you see has had relevant training and experience and that they are registered with a professional body. That's why it is important to undertake relevant training and apply for membership with a professional body like the National Counselling Society. This will help potential clients have more faith in your abilities and also offer protection for both you as a practitioner, such as against false accusations, and for the client.
I see some people call themselves both a counsellor and a psychotherapist. What's the difference? Are counselling and psychotherapy the same?
Psychotherapy, similarly, is a talking treatment, although those practicing as psychotherapists generally undergo more in-depth training. The UK Council for Psychotherapy, UKCP, explain that professional psychotherapists registered with them undergo a 4-year postgraduate in-depth and experiential training in how to work with a variety of people with a wide range of emotional distress, mental health issues, and difficulties. Psychotherapists are trained in one or more of the psychotherapy modalities. Accurately defining the differences between counselling and psychotherapy, however, is difficult. Researchers explain how attempts to distinguish the two are never wholly satisfactory. Psychotherapy focuses on personality change of some sort, while counselling focuses on helping people use existing resources for coping with life better. In both counselling and psychotherapy, the aim is for the client to have a supportive, non-judgmental, and confidential environment where they can explore any emotional or psychological problems they may be experiencing. Within counselling sessions, clients can work with a therapist to identify their own personal resources and capabilities, which can be difficult to identify in times of anxiety. Many people also find counselling beneficial in this way because it enables them to talk openly about their thoughts and feelings, something which very few people find possible to do with friends and family.
So, they are quite similar, but psychotherapy generally focuses on more deep-rooted issues?
Yes, that's correct. Both counsellors and psychotherapists are trained listeners who work with clients to help them overcome problems or difficulties they may be experiencing.
As a counsellor, would I be giving clients advice? What if I suggest something and it makes the situation worse?
No, you're not there to give advice to clients. You would be there as someone who is professionally trained to listen to a client's problems sensitively and with an open mind to understand as fully as possible what is concerning them and how it is affecting their life. Without judging or offering advice, a counsellor can help clients to become more aware of their own inner resources and also how they can use these to help them cope and discover new ways of dealing with difficult feelings, people, or situations. A counsellor will work with clients within an environment of absolute respect and confidentiality.
I work as a nurse at the moment. I spend a lot of time listening to patients who have various problems. Sometimes they say how much better they feel just by having someone to talk to.
I agree. Sometimes people just need someone they can talk to openly without worrying about being judged. They're often worried about talking to family and friends for this reason. There are numerous professions in which counselling skills are part of everyday practice. This may include, for example, those who work as social workers, doctors, or the police.
What skills do I need to be a counsellor?
The BACP, within their ethical framework, similarly identify the following personal qualities. Empathy, the ability to communicate understanding of another person's experience from that person's perspective. Sincerity. A personal commitment to consistency between what is professed and what is done. Integrity. Commitment to being moral in dealings with others, personal straightforwardness, honesty, and coherence. Resilience. The capacity to work with the client's concerns without being personally diminished. Respect. Showing appropriate esteem to others and their understanding of themselves. Humility. The ability to assess accurately and acknowledge one's own strengths and weaknesses. Competence. The effective deployment of the skills and knowledge needed to do what is required. Fairness. The consistent application of appropriate criteria to inform decisions and actions. Wisdom. Possession of sound judgment that informs practice. Courage. The capacity to act in spite of known fears, risks, and uncertainty. We will now look at two of the main counsellor qualities in greater detail. Genuineness. Sutton and Stewart describe genuineness as being oneself, open and transparent in the relationship, not hiding behind a mask of professionalism, also known as congruence, realness, or authenticity. Shapira expands on this further, stating that being genuine or real as a person means not to hide behind a professional mask or other defense. The word that is frequently used in humanistic therapy is congruent. This means that the person's words match their feelings. They are not feeling one thing while speaking as if they felt something else. Shapira describes how, through genuineness, the counsellor models to the client that this is how intimacy formed and maintained, but in order to help a client, the counsellor must first have formed a genuine relationship with themselves. This means they must be honest and respecting of themselves, not wishing they were different, or do not punish or deceive themselves. The counsellor must accept not only what they regard as their good parts, but also have the ability to understand and deal with their own disappointments, sorrows, and pleasures. Only when the counsellor is able to do this for him or herself are they ready to help others. Respect. Shapira explains, respecting someone means you do not judge them or demean them in any way for their values or behaviour, or tell them how to live their lives, or impose your values onto them. Having respect for another is to listen to them. Respecting another is to acknowledge them and value them as a unique human being. When there is respect, the other person feels it. A responsibility of practitioners is to learn to recognize and be aware when their attitudes, beliefs, and values are negative towards others. It takes time to acknowledge our prejudices, but until we do, we cannot challenge them. When we can start challenging them, we are on the way to preventing them from being destructive and harmful to others.
What if a client comes to me with a problem I feel unable to help them with?
There will be times when a client presents with a problem of which you have little knowledge, training, or experience. When this happens, it is important that you explain to the client that you feel it would be in their best interest to refer them to a counsellor or psychotherapist who has more experience in this area. To summarize what we have learned today, counselling and psychotherapy are very similar in that they are both talking treatments. Psychotherapy usually deals with more deep-rooted issues, whereas counselling can help with a specific problem or issue. There is no legal requirement to have any training or experience to be a counsellor, but in order to obtain membership with a professional body, you will need to demonstrate evidence of relevant training. Goodbye, class, and good luck!